you know that half of all American adults have cholesterol levels that are too high, and 1 in 5 have a level within the high-risk zone? This high-risk zones mean that you are at an increased risk of developing heart disease from your cholesterol levels. And heart disease is the #1 killer in America. High cholesterol levels in the blood can join with other fats and substances and cause a buildup within the walls of the arteries. This buildup can eventually lead to a blockage or a rupture within that artery, causing a stroke or a heart attack. I'm interested in this topic because I have a family history of high blood cholesterol and also of heart disease. And as a nurse, I have seen the devastating effects that heart disease can have. So I wanted to learn more about the disease process and learn what I can do about it. The American Heart Association defines cholesterol as a soft, fat-like, waxy substance found in the bloodstream and within all of the cells within your body. The medical term for high levels of blood cholesterol is hypercholesterolemia. Now, cholesterol is an important part of a healthy body because it is needed to maintain hormones within your blood and also to produce cell membranes. But having too much cholesterol in the blood does put us at risk for developing heart disease. Cholesterol comes from 2 sources, your body and also the foods that you eat. Your liver and other cells within your body produce about 1,000 milligrams a day, or 75% of the cholesterol within your blood. And the other 25% comes from the food that you eat. Now, the hard part is finding the perfect balance within what we eat and our lifestyle changes to keep these cholesterol numbers where we need them to be. In the next few minutes, I will discuss the different types of cholesterol, what all of those numbers on our lab reports mean, and also ways that we can reduce our cholesterol numbers and decrease our risk for developing heart disease. First, let's look at the different types of cholesterol found within our bodies. There is the HDL, which stands for high-density lipoprotein. This is termed the good cholesterol. And this within your body helps get rid of the excess cholesterol that is found within the walls of the arteries. The American Heart Association believes that the HDL actually removes the excess cholesterol from the arterial plaque, which slows the progression of the buildup and helps decrease our risk of developing heart disease. There is also the LDL, which stands for low-density lipoprotein. This is termed the bad cholesterol, and this is the type that transports the cholesterol from the liver throughout the body. This is the type that causes the buildup within the walls of the arteries and can lead to heart disease. This model here shows how the buildup can progress. This being a normal artery, with the buildup progressing, leading to a narrowed artery, and then eventually leading to the plaque rupturing and causing the clot formation. If this plaque tears or ruptures, a blood clot may form, and this could stop the blood flow to the heart, leading to a heart attack. Or if the blood flow to part of the brain stops, then a stroke will occur. There's also triglycerides, which are the main storage form of lipids or fats within our body. Secondly, let's look at what all of those numbers on our lab reports mean. Now, because LDL is closely associated with heart disease, it is the main focus when we are watching our cholesterol levels. It is termed the bad cholesterol, and too much of it in our blood can put us at risk for heart disease. Levels should be below 100 for optimal results, and above 160 is considered high, and you may need to speak with your doctor about medications that can help lower that. Now, HDL levels is the good cholesterol, and we want more of that roaming within our blood system. A higher number is better for that. High over 60 is what we consider optimal. And also the total cholesterol levels, which is the sum of your HDL, your LDL, and also your triglyceride levels. Now, the American Heart Association recommends a level below 200 and says that anybody with a level above 240 should speak with their doctor about medications to lower their levels and decrease the risk of heart disease. Lastly, let's look at what we can do to help decrease our risk of getting heart disease and help decrease our total cholesterol numbers. There's a lot of different lifestyle changes that we all can make, whether we have high cholesterol or not. There's dietary changes that we can make, such as cutting down on foods that are high in saturated fat and high in cholesterol. These foods include fatty meats, butter, cheese, and whole milk dairy products. We should also eat more fruits, vegetables, whole grains, and high fiber foods. We can all increase our physical activity. As little as 20 minutes a day, 3 to 4 times a week, can significantly decrease our risk. Also, being at a healthy weight and being a non-smoker are great ways to decrease the risk. If these changes do not lower your cholesterol to optimal levels, it may be time to talk to your doctor about the different types of medications that you can take to help lower your LDL levels. There are 2 different types. One group of medication are called statins, and they work in your liver cells to reduce the amount of cholesterol that is made by the body and helps remove the LDL cholesterol circulating within the bloodstream. Another type of medication is called cholesterol absorption inhibitors, and these work within your small intestines to prevent the cholesterol from being absorbed by the body. There are many things that we can all do to help lower our risk of heart disease by being in control of our cholesterol numbers. The first level is to talk to your doctor and get a lab test done to see where your numbers are at. And then you can make the appropriate lifestyle changes to help decrease your cholesterol levels. Remember the good news. High cholesterol levels are largely preventable. A healthy diet, regular exercise, and other lifestyle changes can go a long ways towards reducing our high cholesterol levels and decreasing our risk of getting heart disease. Thank you.